A severe form of Asherman syndrome or intrauterine adhesions, which will be managed by hysteroscope. The first rule, and the most important, is to know the anatomy. If you knew the anatomy, you will be safe. لازم نعرف الاناتومي كويس زي ما بنعرف اللاباروسكوبي نعرف الهيستروسكوبي. That is the lower part of the cavity, upper part of the cervix. It looks like an owl formed by band of fibrous thick adhesions closing the upper part of the cervix. The second tip is to start blunt, either by the tip of the instrument itself or the tip of the lens, the scope. You can use this to just try to find your way inside the normal anatomical cavity which you are looking for. Of course, starting bluntly will be more safe and will avoid perforation if we start with sharp dissection. The next tip is to look for landmarks, the normal anatomical landmarks. ايه العلامات اللي احنا بندور عليها عشان نتأكد من ان احنا في المكان الصحيح, to know we are in the right place, the cavity of the uterus, and to avoid perforation. Of course, it is the tubal ostium. So finding one of the tubal ostium, like the one we are seeing now, the right tubal ostium, will make half of your day. هتخلي يومك بقى سعيد إلى درجة كبيرة, لأن هي هتخلي ال sense of normal anatomy at least to one half of the cavity, and hence to reduce the risk of perforation. لازم دايما نفتكر ال main objectives بتاعتنا in this hysteroscopic procedure, which is to gain the normal cavity, create a new cavity, and number two, find the remains of the endometrial glands. So we may now shift to the next step, which is sharp dissection or sharp adhesiolysis using scissors. Cutting these thick bands of adhesions with the scissors will be easy, and still using the scissors is much safer than using electrosurgical dissection in terms of perforation avoidance. Always remember that using concomitant ultrasound to make sure that your instruments are within the safe limits within the cavity is very important to avoid the risk of perforation, or at least reduce the consequences of perforation if it occurred. We continue our dissection, now the sharp dissection, using the scissors. Again, you have to be careful. You are now gaining a good cavity. You have to be meticulous, very patient, looking still for the landmarks, for the sign, for the tubal ostium. Something like this happened. If you suspected perforation, always remember using concomitant ultrasound, as we see. Making sure that your instruments are within the cavity still. If you are sure now, continue within the anatomical landmarks, which you can see clearly now between the two tubal ostium. This is the left one now showing, and the right one, and the remaining endometrial islands are now starting to show. You may continue your sharp dissection carefully, making sure that you all the time double check on the progress you made, how much you gained, قد ايه قدرنا نكسب كافيتي جديدة أو أرض جديدة، وقد ايه أجزاء من الاندوميتريوم ممكن تبقى موجودة في المكان الجديد ده، و check for safety by knowing the landmarks and knowing the anatomy all the time. All the time, remember that the cutting or adhesiolysis itself can be endless. يعني ما نقدرش نفضل نقص، كل ما نلاقي حاجة ممكن تتقص نقصها. احنا عندنا هدف نوصل له. we have to restore the normal shape of the cavity, the normal size of the cavity. So we cannot continue dissecting or cutting bands of fibrous adhesions all the time. We have to stop at the objective. There is a time for a third eye. المقصود بالthird eye هنا هو concomitant ultrasound, as we see in the picture, and this picture below on the right shows also the instrument inside the cavity. We can see it clearly, so that an assistant is holding the probe of the ultrasound and making sure that I do not pass beyond this point showing in the ultrasound. And as we can see here, this is the final view, a nice looking cavity, good percentage of endometrial islands, and the prognosis of this case has been improved significantly. Thank you very much.